broken, and nothing showed up on the x-ray. So I will follow up with Dr. Ferguson again this week just to make sure there's nothing else we can be doing to make her more comfortable. But it is a very well, I don't know how common it is. It is, I think, a fairly common side effect of calicivirus, and it also is a side effect of something called mycoplasma, which is a blood-borne bacterial infection. The mycoplasma bacteria is carried by infected fleas, and you know how flea infested they were. So not surprising that she may have been exposed to that as well. So all sorts of things. So that's likely what it is. We are treating secondary bacterial infections right now with an antibiotic that does kill mycoplasma. So at this point, we just unfortunately have to wait and hope that she feels better soon. Right? I mean, she's definitely feeling better from a just general overall health perspective. She's feeling much better, so that's good, right? You're growing and gaining weight and you're playing and stuff. You've got color. She's got color back in her gums, which is exciting. She's still got lots of delightful ringworm. What is that, Amanda? Do you need to comb this for you? She's still very fluorescent, but that's nothing to be concerned about. The time to cure, minimum time to cure for ringworm is 42 days. So we will continue to see fluorescence for quite some time, I would think. The only reason I'm checking is because I'm curious. Because, for example, we know that Jingle has had ringworm since early August. And usually they will self-cure in maybe 4 months. And so it's been about 4 months. So I'm just curious whether he might stop fluorescing sooner than 42 days because he's had it for so long, and presumably he will have started to self-cure. But it does take longer in some cases to cure with the longer haired cats. You're very handsome. Should we give you your meds? I'm running super low on meds. Hoping to have enough. We're getting more tomorrow, but there were none in. 1 point. Looks like you get your dose. I think we may just barely have enough for everybody, which would be glorious. You and Microflute there have the most fluoresciness. He's like, seriously, have we not discussed meds yet? Good boy. This is the only way to get him to stop purring. I don't know why we would want that ever, but it does make him stop purring, which is oh so sad. So sad. So let's see, you get 0.3 of this one. You're doing much better though. Elf and Jingle are doing much better from a snurfle perspective. There you go, boy. All the sneezing and the uh-oh. This syringe is a little bit sticky. Let's try this way. He says let's not. Let's not and say we did. I know, it's no fun. Okay. I don't want to have a misfire. I don't want to have it. Because this is only number 2 out of 3. It's number 2 out of, oh gosh. Are we going to have to burrito you? Do you think that maybe we should burrito you so we don't waste meds? Maybe a light Oh, oh. Oh, that was a mouthful of stuff. Miscellaneous stuff. I know. I guess I deserve it, huh? Because imagine the mouthful of stuff you get. It tastes much worse. But it's probably like, you already have the big one. Here, ready? You're in a burrito. Oh, he's very cute. Okay. Oh, this syringe is really sticky. I'm gonna take one more attempt to get it all the way plunged. Oh, there, got it. Got it. You know what else though? We still have to do your panicure. Panicure is a different dewormer than we normally use, but it gets a few extra things like Giardia and a few other organisms. But you have to give it once a day for 5 days, and then they hate it just like they hate all these other gross meds that I have to give them. Look at Elf being so chill on the shelf. Elf on a shelf. Microfleepy, so cute. Oh, poor Jingle. He feels betrayed. He feels very betrayed. He's gonna feel even more betrayed in a minute. I know, at least this syringe I think is less sticky. But this one gets flung all over the place commonly. Oh, see? He's gonna punch me. This is why we do this. That's why we do that. Oh, I know. I'm sorry. It's very mean. It's very mean. And it's a big dose. It's a big dose. Oh, sorry. But there, we got it all over. That happens most times. Most cats do that and then it ends up all over. But that was good. Okay, he's done. You're done. Maybe you will forgive me. Maybe you won't. I hope you will. Because we've got 3 more days of that to go. And you, at least, microfleets don't get as much. This is your doxycycline to help with your secondary bacterial infections. That one's not so bad. This one is going to be a little yuckier. I'm sorry, but it will make you feel better. Oh, it's so yucky. Good girl. What a good girl. All done. All done. How about some foods? Foods? It's good you had nice human time this morning. You'll have nice human time this evening. Get all the meds done in this visit. Luckily they're all once a day, which is nice. Hello. Chibbity-doo. Mr. Fluff. Mr. Ginger Fluff. How are your ears doing? Oh, not bad. Not bad at all. So in the other room, Holly's sister Joy, what's this one? This is yours, is doing great. She was in my lap, she was purring, she was flopping. I brought her out and she curled up right here when I had mistletoe in my lap. She's doing really well considering 4 days ago she was a feral forest dweller, so that's very exciting. Very happy about that. Jingle's gonna celebrate with a big poop. A big poop. Oh. Oh no. It's pretty gross, I know. Uh-oh. Did we just come to the end of our stash? Oh, what happened? Is it gross? Uh-oh. Oh. Oh, good. We got enough for you. Oh no, that's not it. Oh, bless you. You okay? We'll give you a minute. Did I go down the wrong pipe? Oh, he says that was wretched. Wretched. Oh, I'm sorry. I know it tastes yucky. These 3 meds are some of the most disgusting tasting meds around. And there's nothing we can do to make them less disgusting. Want some foods? Oh, good boy. Oh, we'll give him a minute to work on his that doxycycline and do some. Oh no! Oh, I got her. Elf is getting much better. She would have panicked if I had gone after her like that a few days ago. So she's still got a ways to go, but she does purr. She does purr, and when she's in the lab, it's not so bad. No, she's very sweet. Very sweet. Your little nose. Let's see your little nose. Oh. She's still a little snarkly, but that's what these are for. That's what this is for. Oh, such a good girl. Let's get this. Oh, and Gino's looking at me, giving me the look like he's not impressed. Not impressed. That medicine will help you with your snarfle. Yes, it will. Oh, Nicholas. Little tummy. Look at that little tummy. This medicine will help you with your little tummy, your big tummy, I should say. Elf has a secret purr button inside her ear. Ooh, that's dirty. She always purrs when I clean her ears. Very adorable. You still got some gunk in there, huh? Gunk in the trunk? Oh, good girl. Good girl. Not too bad though. All in all, getting much better. Getting much better, huh? Let's see what else about the other room. Mistletoe is doing great. I changed her bandage yesterday. She's letting me give her meds. She lets me put her in my lap. As long as she's reasonably covered up. I've been cleaning her ears. I'm sorry, this one's really yucky. I'm sorry. I know. I'm sorry. I'm sorry. It's so sad. Oh, don't do it. Oh. I'm laughing because she practices civil disobedience with meds and just refuses to swallow. So we end up with we end up with lots of drooling and angst. Lots of drooling and angst here. Let's go back like this. Oh, she's like, I used to like you, and now I think you're horrible. Here, you can have a little break. You can have a little break. Ooh, there goes. It's good that we have nice humans coming. So, you've recovered from your bad medicine swallowing. He's like, no, I'm going to do it again. And guess what, bud? I've got one more. I'm sorry. I'm sorry. Oh, elf. Poor little elf. This one's gross. I'm sorry. I'm sorry. Oh gosh, I know, I'm sorry. I'm sorry, I know, it's terrible. It's terrible. So tomorrow is bathing and cleaning day. Starting in the morning, probably between 10 and 11. Let's see if I have anything in here. It's not too bad. I might be able to get almost. I think I have a little bit left in the other bottle too, so I may be able to get out all those, and then that will get us till tomorrow. Okay, we've all got an empty warmer and our boxes are clean, and we just have one more. I did manage to get a full dose, which is good. The ringworm meds are about $80 a bottle, and we go through them pretty fast. Oh, I did it. I know, I'm sorry. I'm not very nice. Not all humans are that like me. I know, I'm sorry. And we go through the ringworm meds pretty fast, especially as they grow, because it's dosed by weight. So as they get bigger, which we want, and weight-wise at least, there, I clean your face a little bit there. Oh, I know. Here, let's wrap you up. Let's wrap you up. Oh. As they get bigger, they use even more. And we have to be on it for a minimum of 28 days. And then we'll see where we are. Oh, gosh. I know. Here, let's just see. Oh. Poor Nicholas. Okay, I'm sorry. All right, look, I won't torture you. by making you sit on my lap and trying to give you snuggles, even though I want to give you snuggles. Come with the ear rubbing. You do like that. This is why the snugglers are so important, because when you have a human coming in and just doing horrible things to you, and you're trying to be socialized, you want to associate good things with humans, and getting all these yucky meds doesn't set them up for great success. So it's great to have some humans who are strictly good humans who come in and just do nice things and give them food and snuggles. I can give them snuggles, and I can give them food, but I also have to give them the yucky meds and bathing, ear cleaning, which they don't mind sometimes. Good girl. Good girl. Civil disobedience. This syringe is also a bit, it's good for measuring, but it has a blunt tip, which is hard to get in there sometimes. But there, we got it. We're done with all the horrible things that have to be done to you. So with the bathing and the everything and being feral, it's a lot. It's a lot to ask. It is. It's a lot to ask of you. But that's why we love our snugglers so much. Because if we didn't have them, these guys would have not nearly the good experiences. Because when you're doing just the time it takes to do the meds and do all the mean stuff, there's not a lot of time left over to do snuggling. And then there's also you also don't see the hours and hours of cleaning and laundry and disinfecting that have to happen every time we visit. And they all help with that stuff too. So it's pretty much a 6-person job or more. I should count and see how many people is on our snuggler team. We have Suzanne and Luana and Lori and Amanda and Kimsey's and Gwen. I hope I'm not forgetting anyone. And they have been doing a tremendous job. Tremendous! As you can see, even the elf is getting better. She probably needs the most work at this point. She does have her adult teeth. I'm curious as to how old Dr. Ferguson will think she is, because she has her adult teeth and she doesn't have any gingivitis. So I'd say she's younger than Joy and Holly probably, but probably not by much, and she's so tiny. She's smaller than Holly weight-wise, but adult teeth usually happen between 4 and 6 months. So we assume if they have adult teeth, normally that they're at least 6 months old, or that they're maybe at least 5 months old, but it's always hard to know for sure. She is so little, so it's not surprising that she's having the hardest time adjusting of everyone in this room, but she will come around. She sure will, and we've got plenty of time, don't we? There's no rush, because we've got lots of time. And then it takes 2 weeks to clear them. Once they get their first negative ringworm test, it will take 2 weeks. Oh, little elf. Little elf. We have to wait 2 weeks to get a second negative to make sure they haven't reinfected themselves. And then they'll be cleared for adoption. That will be so great. So we have lots of time. Hopefully we have less time with the other room, but you never, if someone comes back positive in the next round, which is probably pretty likely, I don't know, because we can't bathe mistletoe and I don't know, we'll see. But if they all come back negative, then we will wait another 2 weeks probably, just to confirm. But they should be ready for homes at that point. So probably 4 weeks, well, 3 more weeks for those guys. And then a minimum. And Holly and Mistletoe probably need that much time anyway. Mistletoe is still very fearful. I don't know what her fate will be, if she'll be one that we return and try to work with at the feeding station, or if we would be able to find a home that's willing to keep working with her. I don't know how happy she is in this environment, but it hasn't been very long. It's only been, 5 days, and she's had major surgery, 2 major surgeries, one for a spay and one for her crushed paw. So, and she's about a year old, or a little over a year old, and so it's a lot to expect to think that she would come around quickly, or even at all. So we'll just wait and see and do the best we can with her. She's been great so far, letting me change her bandage, which is not super fun, because you have to remove tape, and they've got a fresh, she has a fresh wound and sutures and everything, so she was very good about that. Why is everybody over there? Where's Mr. Fluff? Oh, he's right here. Here he is. Why is no one hanging out with me? Because I did horrible things to you? Oh, I know. I feel bad doing all the horrible things to you. But you feel better, don't you? You can't say you don't feel better, because I know you do. Very handsome. Look at all that fluff. So this week will be more baths. We'll probably do Monday and Thursday again, I would think. And more meds. Ideally, we would wait until they at least have one negative for ringworm before we do spay and neuters, just because we don't want to contaminate the clinic, especially the sterile surgery room, because that creates a lot of work for them. So we're not in any rush, technically. So Jingle has his baby teeth and his adult teeth, so he's probably around the 4 months mark. So biologically speaking, he could become sexually mature in the next. He could be starting at between 4 and 5 months. Usually is when they first can become sexually mature. We haven't seen anything that would indicate that he is on that path at all. And the only one in this room that would be a worry would be Elf, because if she has her adult teeth, then she is at an age where pregnancy is possible. They can get pregnant as early as 4 months, which is crazy, but true. And she's clearly not in heat or anything like that. So if I had any concern that there was a risk of that, I would immediately separate them. So I am keeping an eye on that situation, because we are not in, what is this in your ear? We are not in the business of making more unwanted kittens. Not that you guys are unwanted anymore, but you were. Now you're gonna have awesome lives. Yes, you are. You are going to have awesome lives. Look, you've got some panic gear in your ears. Oh my goodness. Elf's looking at something. She's got her eye on something. I think she hears the eating noises. Here you go. Pretty cute. So tomorrow will be a long day. I'll try to get the camera out there so you can watch the bathing. I need to get an extension. I think I can use this one maybe. It's almost long enough. You're very cute. So Amanda and Gwen will be helping in the morning, and Kimsey's will be coming in the afternoon. Tori's coming tonight to do snuggles and food. Very special. Very special. I'm trying to get a mount so I can put a monitor in the room that's up high that we can disinfect easier, so that anyone in here can read the chat. Since it's hard because we don't want to contaminate our laptops or our phones, so being on chat is not super possible. I know that sometimes we will contaminate our phones for photos, but it's hard to follow chat on the phone anyway. But I need these baggy. He's so cute. He's so cute. We had such a good visit yesterday with the one. You guys are lucky. So lucky to have such good snugglers. I know. So it would be nice if we could answer questions and like talk to you guys. It's just a little bit of a challenge. It would also be nice if we could do like, you know, some Christmas decorating in here, but anything we put in here, we have to be able to disinfect or throw out. So it makes it challenging. Oh, so many purrs. So many purrs. So nice. Ears are starting to look much, much better. Even though they're still gunk, it's looking much better. Yes, you're so handsome. So handsome. Do you forgive me for doing all the horrible things to you? I hope so. I hope so. So hopefully Joy, Holly Bell, and Comet will all be adoptable from the other room. Jury's still out on Mistletoe. We'll see. What it comes down to is if she will be happy. It's up to her. We want to know if we think she could be happy in a home environment. Even if it takes time, then that's what we'll try to do. Of course, then we have to find a really great home that's willing to work with her and possibly adopt 2 of them. But if she's still fearful and not, and stressed and not happy, then the kindest thing would be to take her back to the feeding station and we can continue to work with her there. So at least it's not, when we return them, it's not like, you know, good luck, you're on your own. We usually continue to see them on a regular basis. So you just put spores on my shoes and my socks. Yes, you did. Yes, you did. So, trying to think of what questions you might be asking, because my ESP is not working right now. Yeah, I'm sure you got. Cassidy is continuing to fight his physical therapy. I have not found anything that I can like strap him into to get a good stretch for an extended period of time, which is what needs to happen. So we are losing ground on his knee flexibility, which is totally a bummer, but the doctor, Dr. Marcel Little, is not super discouraged. He doesn't seem too concerned, but he hasn't seen the latest round of numbers, but we will have a conference call on Tuesday to see what he thinks and if there's anything else that we can try. Cassie just doesn't, well, his stump infection and sore was a big setback because I he won't tolerate any, like really any sort of stretching on that stump because it's sore. And so that one, we've lost quite a bit of ground on his right stump, which was a good one. And there's not much I can do about it other than, just like force him to just like torture him. So I'm trying to find a line between, pushing him a little bit and not causing him pain. So it's not super fun. It's been a little discouraging, but I'm not giving up. We're going to keep working because I don't like the alternative. I'm not accepting the alternative yet. The alternative is that we have to amputate above his knees, and then I'm not sure what we would do at that point, if we would continue to pursue implants and he would walk from his hips, like Vincent, the cat that just had the surgery in Iowa. It's actually, that's super helpful for us because we can see how he does with implants that basically he has his hip joint. He can move his hip joints, but he doesn't have a knee or an ankle. So I'm very interested to see how he does, because I had initially thought that doesn't seem like a very good option, but seeing now how we're gonna struggle with, if I let him continue to scoot, we're gonna have sores all the time. We're gonna have infections. It's not a great option to leave him as is. And of course his knees being hyperextended is going to be painful for him at some point if it's not already. I think that's just going to get worse as he gets older and bigger. So leaving him as is not really an option long term. And so just amputating further up and maybe leaving him that way, I think he would probably also get sores, but then he can never do cat things. And I think probably we would still have risk of sores from him just when he scoots from the rubbing on the floor and everything. So that's why I'm trying so hard to get his knees working. But it's been quite an uphill battle. And there are no devices that exist for his particular problem. So it's been, the garment has been helpful, but it's not able to maintain a proper stretch on its own. So I'm trying to now pair that with something that I can anchor his tibia to pull back, and then have to anchor his thigh forward. And then he has to not move because he will resist, and then his knee just goes all wonky, and then I have to undo the whole thing and give him a minute. And it's and he's quite stubborn, which is great because that's how he survived. But he's now using his stubbornness for bad instead of good. He just wants to be a kitten because he's just a kitten. He does, though. He is enjoying chasing my cats around. Bartlett is his favorite to chase around. And so Bartlett will go whizzing by, and then he stops and waits for Cassidy to catch up, which is really cute. And then he'll jump over him and run back the other way. It's pretty adorable. And then when they're done, they just jump up on the counter where he can't get them. That's pretty cute, though. So he's doing well. Other than that, his stump the hole doesn't seem to be healing he basically has a sore, and that has turned into a small hole. And then because of the physical therapy and the hyperextension, his stumps build up fluid. And so the fluid is then just constantly draining out of that hole. And plus, when it was getting some bacterial growth in there, it's kind of like just an opening to let bacteria in. And so I've been keeping bandages on it pretty well, but it's still having some trouble healing up. So hopefully I can get that under control. The infection seems to be under control and not too severe. We had one day when it seemed pretty painful for him, but it's gotten better since then, but it's still not where we need it to be. So that is the latest on the casserole. You are so cute. I think that's all I can think of to update you on. So, on that note, I guess I will get back to another round of stretching. I did add the feral art cards to our Etsy store, which is tinykittens.com/shop. That the Tiny Kitten store, 100% of the proceeds go to support our rescue efforts. So if you wanted to get 10 note cards featuring original feral cat art, this is what Kinsey's has been doing with her iPad, taking her iPad into the forest and having our ferals paint on the iPad. So they're actually really cool, and you get 10 to a pack, and each pack costs $25 US plus shipping, and so you can buy those if you would like. It's tinykittens.com/shop. We will be adding more things to the shop when there's time. But then these guys came and we got all ringwormy and stuff. But the feral art cards are now available. They're really cool. And it's a good way to support the feral cats. I think we have a limited quantity to sell, but they should get there by Christmas, depending on how far away you are. They make good Christmas gifts. Oh, so handsome. Look how handsome. Look how handsome. So I think that's it. That's all I have right now. Oh, you're too sweet. How did anyone ever leave you and your little friends? Oh my goodness. Should we make a, let's see, put this there. Okay, this is all, make your bed. There we go, bed. Put this little microphone. She's too cute to not be front and center. Oh, too cute. Too cute. Okay. Maybe I'll throw another can of food in here. What do you think? Yum, yum. Oh. So adorable. All right. Bye-bye.